That's a very interesting question. Actually, this week, a paper came out that suggested that everybody over the age of 30 should consider having genetic counseling and testing potentially. But right now, previously, the criteria for having genetic testing involved either looking at your own history or your family history. And for a patient herself, the things that would be important would be having had breast cancer at a young age, about younger than 50, having what's called triple negative breast cancer, and that's breast cancer that has no hormone receptors on it and is negative for a marker called HER2/neu. So basically, when you're looking at your history, these are the things that would make you want to get tested. If you've had breast cancer under the age of 50, if you've had more than one breast cancer, bilateral breast cancer, one on each side, if you've had triple negative breast cancer, and that is breast cancer that has no hormone receptors and is negative for a marker called HER2/neu. If you yourself have had ovarian cancer, and when we say ovarian cancer, we also mean tubal cancer or primary peritoneal cancer. If you're a man and you've had breast cancer, you should absolutely be genetically tested. These are things that you would look at in your family history to determine if you should be tested. If there's an individual in your family that has had 2 breast cancers, if there's any, again, triple negative breast cancer in the family, if there's pancreatic cancer as well as another cancer, if there are 3 or more people with breast cancer on a single side of the family, and if there's a previously identified BRCA1 or 2 mutation in the family. Those are all reasons to get genetic testing. Now, some people will not fall into these categories, but will still have a very suspicious pedigree or family tree, and those people can be tested as well. But the things that I listed are general things that are used as some guidelines for testing.
Hi, I'm Wendy Hartley, co-founder of Breast Cancer Answers. You know, not every breast cancer patient benefits from chemotherapy. When I was diagnosed, my doctor thought I would need chemotherapy. But then I learned about the Oncotype DX test, which helps your doctor decide if chemotherapy could benefit you based on the unique biology of your tumor. My test results revealed I had a very low chance of my cancer returning, which meant I didn't need chemotherapy after all. To learn more about the Oncotype DX test, click this button here.